Welcome back to Drugs and Behavior with Dr. Goodin. We're on Chapter 7 that has to do with marijuana. Alright, marijuana may be the most politicized of drugs in the history of the 20th century. It is praised by some and demonized by others, usually based on emotionally charged issues rather than objective data or facts. Cannabis sativa is the name of the marijuana plant, a scrawny weed that can grow in hot or cold, wet or dry environments with seeds that are unbelievably hardy and prolific. It needs very little cultivation, if any. It devours the nutrients in the ground. And it has been found in median strips of interstate highways, in ditches alongside country roads. It is difficult to classify marijuana among psychoactive drugs. Marijuana produces excitatory effects but is not generally regarded as a stimulant. It produces some sedative effects, but there is no risk of slipping into coma or dying. It produces mild analgesic effects, but it is not an opioid. It produces hallucinations at high doses, but does not resemble LSD or any other hallucinogen. Note the difference between marijuana and cannabis. Cannabis is the shortened botanical term for the hemp plant Cannabis sativa. It has a potential height of 18 feet and sturdy stalks with commercial value for rope, twine, shoes, sailcloth, and containers of all kinds. Pots made of hemp fiber dated back to the Stone Age. It is arguably the oldest cultivated plant not used for food. Spaniards brought cannabis to the New World, and English settlers brought it to Jamestown, Virginia, where it became a major commercial crop, along with tobacco. George Washington grew cannabis like most of his fellow farmers. Marijuana is not obtained from the stalks of the cannabis, used for rope, but from its serrated leaves that contain a sticky substance or resin that accumulates on these leaves. Depending on the growing conditions, cannabis will produce either a great amount of fiber or a great amount of resin. In a cool, humid climate such as North America, less resin is produced, but the fiber is strong and more durable. In a warmer, less humid climate such as North Africa, the fiber content is weak, but so much resin is produced that the plant looks as if it is covered with dew. Note that the fiber is good for rope and the resin is good for getting high. There are as many as 80 separate chemical compounds called cannabinoids in cannabis resin, but the main active ingredient is THC. Marijuana consists of leaves and occasional flowers of the cannabis plant that are first dried and then shredded. In the 60s and 70s, marijuana imported mainly from Mexico, and had a THC concentration of 1 to 2%. Currently, THC concentrations have risen to about 10%, primarily due to advanced outdoor and indoor cultivation methods. Marijuana is usually smoked as a cigarette in North America. A more potent form of marijuana is obtained by cultivating the unpollinated or seedless portion of the cannabis plant. Without pollination, the cannabis plant is bushier, the resin content is increased, and a greater THC concentration, up to 15%, is achieved. This form is called sinsemilla, meaning without seed. Another cannabis product, hashish, is achieved when the resin itself is collected from cannabis leaves and then dried. It can be smoked by itself or in combination with tobacco and has a THC concentration as high as 24%. The most potent forms of cannabis are hashish oil and hashish oil crystals, produced by boiling hashish in alcohol or some other solvent, and filtering out the alcohol, leaving a residue with a THC concentration ranging from 50 to 60%. It was referred to in about 3000 BC by Chinese emperor who sought to use it as a medication for rheumatism, gout, malaria, and absent-mindedness. In India, its use was clearly recreational. It was and still is used in a syrupy liquid form called bhang. Cannabis became popular among Muslim individuals because it was not prohibited by the Quran, as was alcohol. They developed hashish, which spread to Persia, now Iran, and to North Africa. French soldiers in Napoleon's military brought hashish back with them from Egypt, which became popular amidst the wave of Romanticism. French artists, writers, and intellectuals met together to consume hashish and discuss literature, art, and love. Marijuana and hashish in the 20th century is next. By 1890, cotton had replaced hemp as a major cash crop in southern states. Some medicines contained marijuana in a small percentage. Marijuana smoking became a social phenomenon in the 1920s during the time of Prohibition, especially among jazz musicians and people in show business. Marijuana clubs, called tea pads, were common in major cities, outnumbering speakeasies. Marijuana was not considered a threat. The Federal Bureau of Narcotics began to change public image of marijuana in the late 1920s by calling it a killer weed and a pestilence. Their campaign against marijuana was encouraged by racism against Mexican immigrants who used marijuana as a casual part of their life, a mild euphoria, and a folk remedy for headaches. During the Depression, it was convenient to vent frustration on immigrant groups who competed for a limited number of jobs in a weak economy. The Federal Bureau of Narcotics also produced movies that were anti-marijuana themed, such as the movie Reefer Madness. The Marijuana Tax Act of 1937 did not ban marijuana, but taxed growers and buyers. Paying the tax was very difficult, even for those who wished to do so, making cannabis sales illegal in many states. The federal government considered marijuana smoking to be antisocial behavior. The idea of marijuana causing pharmacological violence faded without evidence to support it. It would soon be emphasized as a gateway drug to more dangerous drugs. Criminal penalties for involvement with marijuana steadily increased. At one point, state judges had the option of sentencing a marijuana seller or user to life imprisonment. In Georgia, a second offense of selling marijuana to a minor could be punishable by death. In 1969, the U.S. Supreme Court ruled the Marijuana Tax Act unconstitutional, but marijuana was considered illegal. Challenging old ideas about marijuana prior to 1960, social deviance was unpopular, and most Americans avoided marijuana, leaving it to ethnic and racial minorities. By the mid-1960s, deviancy increased and experimentation became more popular. Regarding acute effects of marijuana, in the United States, THC is usually ingested by smoking a hand-rolled marijuana cigarette referred to as a reefer or a joint. Its potency depends on the specific THC concentration of the marijuana, how deeply the smoke is inhaled into the lungs, and how long it is held in the lungs before being exhaled. THC effects are felt within seconds and peak within 10 minutes, after which they start to decline. Behavioral and psychological effects last for 2 to 3 hours. THC lingers in the fatty tissue for many days, which may increase the ease of getting high soon after. Implications for drug testing are that THC stays in the body for a long time and may test positive for weeks after inhalation, especially for chronic users. Acute physiological effects are relatively minor. Heart rate increases, but blood pressure either increases, remains the same, or decreases, usually depending on whether the individual is sitting, standing, or lying down. Bloodshot eyes and drying of the mouth and an urge to drink are common. Some physiological effects, such as having the munchies, may be societal or psychological, in that while North Americans commonly crave sweet things to eat, Jamaicans consider marijuana to be an appetite suppressant. North Americans believe marijuana to enhance sexual response, while those in India feel the opposite. These are results of expectations. However, there is some evidence to support low doses of marijuana enhancing sexual desire, while high doses depress it, even to the point of impotence. In 2011, there were 500,000 emergency visits that involved marijuana. First-time users often feel very little. The marijuana high is a feeling of euphoria and well-being, an increased awareness of surroundings, and a sharpened sense of sight and sound. A feeling that everything is suddenly very funny, and that mundane ideas are filled with profound implications, and an increase in creativity despite objective evidence to the contrary. Time seems to move more slowly, and events seem to last longer. Users feel sleepy and sometimes dreamy. Marijuana users struggle with tasks that involve attention and memory. Speech becomes fragmented and disjointed. Individuals forget what has been said. This is most likely due to the rush of distracting ideas that come to mind and disrupt concentration, decreasing short-term and long-term memory tasks and complex motor tasks. They react as quickly but have difficulty attending to peripheral information and making the appropriate response while driving. They are 3 to 7 times more likely to be involved in an accident as drivers without THC. Sensory motor performance can be affected long after the high ends. Marijuana use may cause paranoia and increased anxiety. There are special THC-sensitive receptors in the brain that have to do with short-term memory and motor control. They are already present due to a natural substance in the brain that produces similar effects called anandamide. Although experienced users of marijuana tend to become intoxicated more quickly than inexperienced smokers, tolerance within a laboratory has been shown to increase consistently. The reverse tolerance, or greater sensitivity, seems to be due to a mastery of breathing technique. The slowing of elimination of marijuana from the body may also complicate tolerance studies. Withdrawal symptoms may occur in short-term and long-term users, resulting in feelings of irritability, stomach pain, anxiety, and loss of appetite, usually within 48 hours and lasting at least 2 days. Chronic users may have more substantial withdrawal symptoms. Although THC significantly increases heart rate, it is not usually considered a danger to young, healthy people unless they have a pre-existing heart disorder. The technique of marijuana smoking involves the deep and maintained inhalation into the lungs of unfiltered smoke on a repetitive basis, which is the worst possible scenario for incurring chronic pulmonary problems. Marijuana joints compared to tobacco cigarettes contain about the same level of tars, 50% more hydrocarbons, and an unknown amount of possible contaminants. Marijuana smoking may affect breathing, leading to asthma-like symptoms and other breathing difficulties over time. One joint has the amount of carbon monoxide as 5 cigarettes and the amount of tar as 4 cigarettes, although the amount of harm is reduced by the use of a water pipe. Due to a lack of sufficient evidence, marijuana has not yet been tied to cancer, but the number of known carcinogens in marijuana smoke make it likely. THC suppresses the immune system, resulting in a reduction in the body's defense reactions to infection and disease. Research on long-term effects has not yet been conducted. Marijuana smoking adversely affects both men and women's reproductive systems. In men, it reduces the level of testosterone, sperm count, and the percentage of abnormally formed sperm. In women, marijuana reduces the level of luteinizing hormone, a hormone necessary for the fertilized egg to be implanted in the uterus. One joint immediately following ovulation is sufficient for luteinizing hormone suppression to occur. There's not yet any evidence to show that fertility is affected or that there is an incidence of birth defect from pregnant mothers who use marijuana. However, mothers who use marijuana have a reduction in breast milk and babies with lower birth weight and shorter length. Amotivational syndrome describes the chronic marijuana smoker who is youthful but has a general sense of apathy in their lives and an indifference to any long-term plans or conventional goals. Marijuana smokers are at an academic disadvantage, earning lower grades in school, less likely to continue to college, more likely to drop out, and miss more classes. High school students who smoke marijuana on a daily basis reported a loss of energy at 43%, negative effects on relationships at 39%, interference with work and the ability to think clearly at 37%, less interest in other activities at 37%, and inferior performance in school or on the job at 34%. Note that these are correlations and not causations. For instance, does marijuana make a student lazy, or does a lazy student take marijuana? Again, marijuana intoxication produces significant cognitive deficits, inattentiveness, and memory impairment. Heavy marijuana smokers have cognitive deficits even 12 to 72 hours after abstinence. Cognitive deficits do not seem to last more than 3 days if marijuana use is stopped. However, brain abnormalities associated with heavy marijuana use over a long term negatively impact information processing and inhibit impulsive behaviors. The gateway hypothesis is the contention that marijuana leads to greater incidence of drug abuse in general. There is evidence that alcohol and cigarettes precede marijuana, and marijuana precedes use of other illicit drugs, though many marijuana users do not use illicit drugs. Marijuana smokers are several times more likely to consume illicit drugs, such as cocaine and heroin, during their lifetime, than those who never smoked marijuana. The greater the frequency of marijuana smoking, and the earlier an individual first engages in marijuana smoking, the greater the likelihood of his or her becoming involved with other illicit drugs in the future. A twin study showed that early marijuana users were about 2.5 times more likely to use heroin later in life, 4 times more likely to use cocaine or other stimulants, and 5 times more likely to use hallucinogens. They are twice as likely to become alcoholic and twice as likely to develop any form of illicit drug abuse or dependence. Do you think these facts deter marijuana usage? What is the population that is most interested in using marijuana? Should we try to deter people from using marijuana? If so, are there more effective methods? Eric Goodin described 2 arguments for causation. The intrinsic argument asserts that some inherent property of marijuana exposure itself leads to physical or psychological dependence on other illicit drugs. The pleasurable sensations induced by marijuana create a biological urge to consume more potent substances through a combination of drug tolerance and drug dependence. The sociocultural argument holds that the relationship exists not because of the pharmacological effects of marijuana, but because of the activities, friends, and acquaintances that are associated with marijuana smoking. The sociocultural explanation asserts that those who smoke marijuana tend to have friends who not only smoke marijuana themselves, but also abuse other drugs. These friends are likely to have positive attitudes toward substance abuse in general and to provide opportunities for drug experimentation. Most professionals in the drug abuse field support the sociocultural argument for a causal link, though none can be proven. Marijuana is the most dominant illicit drug in U.S. society today, used by 80% of current illicit drug users. For more than 6 out of 10 illicit drug users, marijuana is the only illicit drug being used. 108 million Americans, about 42% of the U.S. population, over the age of 12 have smoked marijuana at least once during their lives, based on a 2011 study, which is likely a low estimate. More than 18 million Americans are estimated to smoke marijuana within the past 30 days. High school seniors surveyed in 2011 reported that 36% of them have smoked marijuana in the past year, 23% had done so in the past month, and 7% had smoked on a daily basis. Among 8th graders, 13% had smoked marijuana in the past year and 7% in the past month. Current prevalence rates among young people are substantially lower than those in the 1970s, but smoking rates are increasing. Note that this information comes before legalization in any state or in the federal government. Modern-day marijuana is more potent than in the past, as high as 15% THC concentration. Most synthetic forms of marijuana can produce serious adverse side effects, for example, spice. A third concern is the adulteration of the illicit drug, as with any street drug. Without regulation, you cannot be certain what you are buying or what exactly is in it. Marijuana has been useful for glaucoma and asthma, but other legal drugs are just as useful. Today, the focus is to use marijuana on chronic pain, muscle spasticity, nausea, and weight loss. Subjective reports suggest that marijuana is useful with mobility issues such as in multiple sclerosis though scientific studies do not support this claim. However, 2/3 of the patients reported feeling relief from muscle spasticity and associated chronic pain. Patients often report relief from cancer-related pain as well as phantom limb pain. The nausea resulting from chemotherapy and weight loss associated with cancer, AIDS, and Crohn's disease may be treated with THC. However, the administration through smoking presents health risks to the lungs, and marijuana is insoluble in water. It cannot be prepared for injection. 2 Schedule II drugs have been developed using THC to treat nausea. As you all know, advocacy for the medical use of marijuana has grown considerably in recent years, and some states have legalized marijuana, although at the time of this recording, the federal government has not legalized marijuana. The government seems to dislike the uncertainty of unregulated marijuana that is smoked, citing that the effects cannot be known or consistent. Instead, they support chemical formulations. Over 18 states have legalized the use of medical marijuana, while only a few have legalized regular marijuana. Medical marijuana is only given under tight scrutiny and restriction. At this point, it is unknown how the illegality on the federal level will contend with the legality on the state level, in states such as Washington and Colorado specifically. Canada has approved medicinal use of marijuana since 2001 with physician approval, and marijuana can be obtained free of charge from government-operated cannabis farms in Manitoba. The FDA is testing a liquid spray of cannabis that would circumvent the arguments against marijuana smoking and lung health issues. Decriminalization is the policy of making the possession of small amounts of a drug subject to a small fine but not criminal prosecution, a process that has taken place in many states. The effects of decriminalization on use, increase or decrease, is not yet known, though there is some reason to believe that decriminalization may take away some of the usage based on rebellion factors. Current age of legalization seems to be 21 years of age. So what will this do to the usage among high schoolers, who often use alcohol because they are not supposed to? According to a 2013 Pew Research Center national poll, 52% of Americans now favor legalizing marijuana, while 45% are opposed. Thank you, and I'll see you in Chapter 8.